Warrington and Halton Teaching Hospitals NHS Foundation Trust is currently treating 117 COVID-19 patients compared to 98 6 months ago. What impacts is this having on ICU wards and staff morale in these areas? Dr. Layla McCay is Director at NHS Confederation. Hi there, morning.
Good morning.
What's the picture?
Well, I think it's all looking quite concerning. Certainly if you're in the northwest, the northeast and Yorkshire, then what they're seeing is this really quite steady increase in cases. And I think that if you're not in those areas, you're looking towards those areas and wondering what is coming down the line. So it is certainly a real concern for our members at the moment.
But we're coping with it better and treating it better now, aren't we?
Absolutely. I think that there's been a lot of learning and improved care as we went through the first wave and figured out how to best manage these things. There's a lot more system working at this time around. There is less concern about things like PPE supply, and there's a lot more infrastructure in place to manage other patients. For example, digital infrastructure and things like that. But at the same time, there are a lot of challenges. We're still operating in a situation where there's about 90,000 vacancies in the NHS. The workforce are exhausted. The amounts of infection control within hospitals and GP surgeries and other places is reducing the capacity. And, moving into winter, it's not just COVID-19 that's challenging. We're expecting, various other demands on the NHS. So it is certainly a difficult time, and the next couple of months are going to be critical.
What are the demographics of those people who are in hospital? Mainly people over the age of 60?
Well, it's a range now. I think that, just a few weeks ago, we were thinking, there's lots of young people, but now really the older people are starting to catch up with that. And of course, as we know, the older people are at a higher risk of developing those complications. So we are certainly now seeing the older people coming in, but it continues to be a range of ages.
And moving ahead, of course, and this is something that applies to all of us, we're trying to see, is there an end in sight? Is there that little chink of light at the end of the tunnel? For people working on the front line, just keeping going, keeping that morale up, must be tough.
It is difficult. I mean, of course, for NHS workers, it's their job and that's what they're doing. But in the first wave, there was this sense of everybody was going to pull together and work incredibly hard to manage this emergency situation. And then come the summer, they should have been able to have a little bit of a rest as the cases reduced. But in fact, they couldn't because they were trying to bring back all the different types of services that had to be paused during the first wave. So they've moved from that to now having to maintain those services and go into a second wave. And it is a real challenge. I think that when we speak to our members, the huge majority of them, at least 9 in 10 of NHS leaders, cite staff well-being as one of their biggest concerns going into the second wave.
Sure. Just finally, much talk this morning of Christmas and maybe just bending the rules at the edges. Maybe 7 people round. Maybe I won't count the kids where kids are counted. It's just let's just do this for Christmas because it's such a special family occasion. If anyone is thinking of, frankly, breaking the rules at Christmas, what would your message be to them?
My message would be that the rules are there for a reason, and it's incredibly frustrating. But if you think about where is the highest risk of passing on the virus, it's indoors in close contact with others. And the possibility of getting together, travelling across the country to see family members, to be close, it's so tempting. But at the same time, it is something that could very well cause a massive, massive risk to many, many thousands of people. But at the same time, we're talking about Christmas right now. What we're seeing is a trend going in a very concerning direction. And I think that as we get towards Christmas, it might be the case that the situation is much worse. It might be the case that it's not. It's hard to know exactly what's going to happen, but it seems at the moment that we all really need to follow the instructions that are coming because actually, if we don't, we could be in a really difficult situation in the NHS and throughout the whole of our population.